Angie, I hear Michael talk, and one of the things that strikes me, because I know in the rest of the healthcare world, is when you can decrease cost in one space, it opens up resources in another space. And I think about the challenges of athletic training, for example, and whether that's salaries or additional bodies or personnel. And when I hear Michael talk about their experiences and being able to save, hundreds of thousands of dollars in resources based on where you might traditionally go for healthcare, what immediately comes to my mind in athletic healthcare is the ability to enhance either the pay or enhance the potentially the number of individuals of the most critical piece of athletic healthcare, which is the athletic trainer. So now we have maybe the potential for additional pay, additional bodies, a way to enhance and avoid burnout in that situation, and create a strategy where, when I think about this in just a healthcare space, you can spend, for example, less than what it costs to employ an FTE to employ a suite of services and take the savings, which could be 3 times that amount, to enhance what you're already doing with your personnel or adding personnel. And I don't know, to me in the athletic healthcare space, it's those kind of innovative thoughts that are really going to, I think, help preserve the most important resource, which is the athletic trainer. Because without that, I fear that there's going to continue to be the things we're seeing in other areas of healthcare, in nursing, other allied health professions, anesthesia, other areas where there's high levels of burnout, and you see people getting out of those professions. But we can't have athletics without the experts in athletic training.
Yeah, I mean, I think that what we're hearing from all of our partners and from presidents and athletic directors and conference commissioners is that they're talking about athletic trainers for the first time, probably in a long time, because they have less of them, or they're having trouble attracting them or retaining them. So I think it's all on their radar right now. One of the things we have to do is help them find some solutions. And I think looking at how we're providing healthcare differently, whether it's what we do as athletic trainers and what our role should really be, and being able to practice at the top of our license. Because if you think about it, as Michael mentioned, the regular consumer, it's hard for them to understand the healthcare industry. They think it's just a cost and we pay a cost. They don't understand where you can save money, where there's more resources, where more expenditures occur. So as those healthcare professionals, that's one of the things that we can do, is bring solutions and options to the table to potentially help free up other resources for better salaries, for more personnel, or to use our personnel in a different way. So I think that's a really good point that could be very beneficial to institutions or organizations.
Yeah, I think when I think about, even team physicians or, other mental health professionals in athletic healthcare, we hear about kind of their overwhelming, utilization, and it's real that student athletes have great needs, as they come into those into their areas, especially in the collegiate setting where we're kind of focusing here this evening.
When I think about this a little bit, just to kind of add on to that, is I look at it, it's almost level setting like your patient care load. So as an athletic trainer, if we think about this, I was getting a ridiculous number of calls of people that, were congested or had a headache, or, were sick and may have the flu and didn't want to go to urgent care, but I'll just call my athletic trainer. Well, it used to be that those calls were minimal. You never got the call at night. You never got the call at midnight or at 5 o'clock in the morning or 4 o'clock in the morning. But, consumers now are used to, they want immediate answers and they want immediate information. So there's only so much you can do from home as an athletic trainer. So having an option that they could get a virtual consultation or have a virtual call with somebody could be really beneficial. It's same thing from a mental health perspective. The number of people that would come in that were challenging from a mental health perspective was 25% of what it is now. So it's providing you that additional resource so that you can go back to level setting your original level of patient care, which I think most athletic trainers want to be able to do now. They're feeling very overwhelmed by the number of patients that they have. They know they can't possibly provide all the care for every single person that walks in. So what are some things that can help assist you? We're not looking at a virtual person to be able to help us with an ACL tear. We're looking for some of that other resources that maybe can help offset some of the burden that we're feeling at our current time.
Yeah, and I think we all know from the recent past, the critical importance that the athletic trainer plays, in things like emergency preparedness, emergency action planning, providing emergency care. And I think about, unfortunately, that does take care coordination and bodies, but they need to really operate at the height of their license to be able to do those things. And I can be challenged. I mean, I've heard stories of, institutions now or organizations with just one athletic trainer for 600 athletes. And I think about that, that's just overwhelming, right? I mean, that's like, if we don't have other resources, it's just, it's no wonder that there's burnout and challenges. And if we can't duplicate the athletic trainer, there's real challenges there. But I think when I hear you talk about this, it is really critical to think about, how does the athletic trainer, one, level set, number two, really provide that expertise at the top of their license, and then three, innovatively think about coordination and having resources for student athletes, if they go home, if they go on the road. I mean, it may not be as critical right when they're sitting right in front of you, but to have that resource, to me, seems to be another layer of care that helps you level set, which you just talked about, which I think is just a really really interesting opportunity.